Good morning. It's Friday the 3rd of January. The government's launching an independent commission which it hopes will transform adult social care in England. But it won't publish its final proposals until 2028.
Some in the care sector are describing the timetable as far too long and say changes are needed urgently. Here's more from our social affairs editor, Alison Holt.
We're living longer and more of us have complex health needs. But the care system that supports people in care homes or in their own homes has been in crisis for years. Councils who buy most care and service providers say they're juggling growing demand against underfunding and staff shortages. The government says care costs will double in the next 20 years. So the task for the new commission is to draw up sustainable and affordable plans for the future.
I hope that the pace of the change that we've already been making in the last 6 months, the additional reforms and funding that I'm announcing today on social care, and our intention to work at pace with Louise Casey does reassure people that we are gripping the social care crisis, that we're looking to stabilise the sector over the next 12 to 24 months, but also to deliver the reforms we need for the medium and the long term to make sure that we've got a national care service that's fit to meet the needs of older and disabled people in our country. I wish we could fix these problems faster, but I don't have a magic wand.
The new Care Commission will be led by Baroness Louise Casey, who has led past government inquiries and has a reputation for getting things done. The Commission will start work in April. It's been told it must build political and public consensus to avoid the arguments that have led to the failure of past plans. Proposals for medium-term reforms will be published by mid-2026. But the final report, with its plans for how care services will be organised and paid for in the long term, is unlikely to be delivered before 2028. Care providers say they need a plan for the future much sooner.
The announcement about an independent commission led by Baroness Casey looks to many in the sector as a government delaying tactic. It's not going to report for 2 to 3 years, as I understand, and it feels like fiddling while Rome is burning. If the government wants to make this work at scale, we need a completely different approach, not ignoring social care, but drawing it in and funding it properly.
The government says it is also setting out plans to train more care staff to carry out health checks and providing an additional £86 million before April to make home adaptations that help people with disabilities remain under their own roofs. Alison Holt, BBC News.